Hey, it's Dr. Bill with just the tip of urology school, and today we're going to discuss VIMA, violence in medical America. Our offices are not equipped to protect the physicians, the providers, the nursing personnel from crazy violent behavior that we're really seeing an uptick in. Pay attention to the media reports of violence and aggressive behavior on nursing staff and physicians and providers at all levels. Understand that we are targets, whether it's a function of frustration over expensive procedures or poor insurance coverage, poor availability of medicine and supplies, empty promises from advertisers and insurance institutions, all involve promises from healthcare that many feel are just not simply being met. Increased feelings of being disrespected and a sense of entitlement from our patients. They feel that the concerns with appointments and the long waits that we see in many of our clinics are directly targeting them. They're disrespecting them. All feed into a bizarre sense that the patient is a target. Remember, urologists deal with potentially embarrassing and potentially humiliating issues: sexual dysfunction, fertility concerns, urinary incontinence. All these can magnify patients' self of being the target of inappropriate behavior. Concerns regarding outcomes that weren't anticipated, or not meeting patient expectations of treatments or any intervention. We are here as providers to educate, to treat, and unfortunately, sometimes to de-escalate. We did not sign up for this to be targets of bad behavior, of threats, and of violence. Every medical facility in the United States needs a plan of action to keep you safe. I know this because simply I wrote the book. Read it. This is the best chance you have of getting home safely. It might be the only chance you have. Dr. Bill with just the tip of urology school and VIMA, violence in medical America.